Hello and welcome. The following presentation provides a brief overview of our research team's plan for understanding the conversion from prediabetes to type 2 diabetes in children. We'll discuss some health constructs along with an analytic plan that we think would further our understanding of the health issue. Diabetes is a group of metabolic diseases characterized by high blood glucose levels resulting from defects in insulin secretion, insulin resistance, insulin action, or both. 90% of all diabetes cases are type 2 diabetes. After asthma, type 2 diabetes is the most prevalent disease in children today. The progression from prediabetes to type 2 diabetes in children and youth is marked by weight gain and further reduction in the secretion of insulin and insulin resistance. This model demonstrates various risk factors that are associated with type 2 diabetes. Some of the risk factors are C-reactive protein, increased dietary intake, physical inactivity, insulin resistance, puberty, and family history. As you can see in the model, most of these factors are interlinked, eventually leading to type 2 diabetes. The health constructs we'll discuss in the study are mentioned here. In past research, dietary intake has been positively associated with increased risk of conversion of prediabetes to type 2 diabetes. In order to measure dietary intake in the children participating in the study, we will use food frequency questionnaires. Food frequency questionnaires are detailed, specifically designed for self-administered questionnaires. They are practical and cost-effective. The questionnaire collects long-term dietary intake from large numbers of the study participants simultaneously. These FFQs will be filled by the parents on behalf of their children. The second construct we've included is physical activity. Physical activity lowers the risk of acquiring type 2 diabetes. High sedentary behavior increases the risk of acquiring type 2 diabetes. Our study will be using the School Health Action Planning and Evaluation System Physical Activity Questionnaire, which has been widely used to study teens and has shown to be a highly reliable measure of physical activity for teens. C-reactive protein is a reactant that is secreted by the body during acute inflammation. It is associated with a greater risk of acquiring type 2 diabetes. Our study will use an immunoturbidimetry that uses Roche-Tina Quant CRP reagent to measure C-reactive protein. This measure requires a blood sample and is widely used for determining risk of type 2 diabetes. This test has high reliability and validity. The next construct we'll discuss is insulin. Now you may wonder to yourself, how does insulin relate to type 2 diabetes? Well, for a person who has type 2 diabetes, their bodies don't use insulin properly. This occurrence is known as insulin resistance. In the beginning, the pancreas creates extra insulin to make up for it. Over time, however, the body isn't able to keep up and can't make enough insulin to keep the body's glucose at normal levels. For insulin, we will use the C-peptide test as our measurement tool. The C-peptide test requires a blood sample and is useful in determining different treatment requirements of type 1 and type 2 diabetes. It is more reliable and inexpensive compared to other tests, and is also more stable in blood and reliably measured on a spot urine sample. Obesity is a term used to describe amount of body fat. Lack of physical activity, unhealthy dietary habits cause obesity. Obesity leads to insulin resistance. Obesity is assessed by the body mass index, which is measured using the CDC BMI growth charts appropriate for age and gender. BMI is a ratio of weight to square of height. It is non-invasive, convenient, inexpensive, accurate, and a valid measure of body fat. Graphic representation on the growth chart makes it easy to track changes. Diabetes is diagnosed mainly by assessing blood glucose levels. The measurement tool we'll use to measure diabetes is hemoglobin A1C. This test provides an estimate of the blood sugar level over the past 2 to 3 months and can be used to estimate the average blood sugar level, called the estimated average glucose. This test also has an accuracy of 93% in detecting undiagnosed diabetes. This is a 4-year longitudinal study conducted in pre-diabetic children from the age of 10 to 14 years of age. The staff will be trained. Study participants will be chosen based on the inclusion and exclusion criteria. Informed consent will be obtained from parents and participants. The blood test will be used for analysis, and all measurements will be analyzed using a statistical software to provide results. Relative risk will be reported for all the constructs. Univariate and multivariate, linear and logistic regression will be done to identify significant predictors. Mixed model analysis of covariance will be adopted for the final predictive model. To reduce the issue of missing data, we will conduct a representative of the non-responders again. We will also contact a representative of the non-responders again. To reduce selection bias, the study will include sampling with replacements. It is with hope that if implemented correctly, our proposed methods and research design would lead to an enhanced understanding of type 2 diabetes. The acquired knowledge, in addition to evidence from previous research studies, would hopefully lead to the creation of improved intervention programs, policy change, and implementation, and overall improved health outcomes of children regarding this health issue. Thank you.